Hi, this is Pat Iyer with Legal Nurse Podcast, and I have the pleasure of sitting in New Jersey talking to a New Jersey physician, Dr. Hamid Elmyar, who I met through a networking group. He has an unusual background and has come to the world of health from growing up in Afghanistan and becoming a physician in Afghanistan and seeing the problems associated with lack of knowledge and lack of resources that affect people in his part of the world. He came to the United States, he earned a master's in public health, and his focus now is on looking at health in a broader way. He is the host of the Dr. E podcast, and he is focused right now on bringing providers around the same table to talk about some of the health challenges that we have. Hamid, welcome to the show.
Thank you so much, Pat. Thank you for having me. It's a pleasure to be here today and talk about this very critical topic that you have in mind today.
And that leads me to my first question. I know that you focused a lot on burnout. Why is that a critical topic?
Mm-hmm. Well, Pat, thank you again. I just wanted to remind your audience that my podcast, as you just mentioned, is with Dr. E, because there's another one which is Dr. E only, and mine is with Dr. E, with WITH. So that's just a clarification on my podcast. And so before answering your question on burnout, which is really important topic, I just, as you mentioned, that I studied medical school back in my country of origin in Afghanistan. I was a pediatrician there doing my residency, and then I came here in the US and did my master's in public health. I just wanted to briefly say about why did I do that, because you just mentioned that and how interesting it is before I talk about burnout, because that is my why. And I always ask people to tell me their why. And it's very important to know the purpose of what we do and why we do what we do. So as I grew up in Afghanistan, as you mentioned, I always wanted to help people. And I said, why not becoming a physician? So that's a better way to help people. And I went to medical school. I studied in Kabul Medical University, graduated from medical school. And then I was asking myself, now that I am a doctor, like a general practitioner, am I really able to help people? And the answer to me at that point was really no, because I was not able to help people. So I said, maybe I should focus more and specialize in something so that I can be more helpful. So that's why I decided to do a master's in residency in pediatrics. And unfortunately, the children are the most vulnerable members of the society, not only in Afghanistan, but across the world. And that's why I started to, for the second time, I asked myself when I was doing my residency, and unfortunately, a lot of patients were coming there on a daily basis, suffering from easily preventable diseases, such as diarrhea or pneumonia. And most of them really didn't need to come to that hospital, a tertiary hospital, which in other words is a university hospital for complicated cases. But then I asked myself for the second time, am I really helping people? And the answer was no. Why are these people getting sick in the first place? And how can we prevent this? What are the root causes? So that's why I decided, and that's my why, that had that shift, paradigm shift in my career, which from clinical to more of public health. And I did my master's here in the US, focus on community health education, in order to have that upstream systematic approach to health. And the reason I mentioned this about the purpose or my why in this story is because later on when we talk about the important topic of burnout and how all these things are related. And to answer your question now, the burnout, as you mentioned, is a very critical topic, especially in the health industry. And when we talk about burnout, I just wanted to say like a little brief history of this, how it actually developed. The first time actually in the mid 1950s, when the stress was considered as a occupational hazard, and then it was basically in the 70s that it was actually first time burnout found its way in the research. And when we talk about burnout, we automatically think about Herbert Freudenberg, who coined this term for the first time in 1974. And the WHO, or the World Health Organization, also has a definition of burnout, which basically defines burnout as a syndrome that is conceptualized as a resulting from chronic workplace stress that has not been successfully managed. And they characterize that into like 3 dimensions, which again later on we'll talk about that. And I don't want to go into details for now. And there is a debate, actually. Some people say it's not only work-related or workplace stress, that we can talk again as you may have questions about that.
So when you say it's not only workplace stress, I guess that raises the question of, if you have a supportive family environment and a very difficult work environment, are you at lower risk for burning out, or does family support not make a difference?
That's a very good question. Definitely the support system, whatever it is, if it's the family, if it's at work, that definitely helps in terms of decreasing the burden of burnout and getting burnout easily. However, the very definition of WHO, which says it's an occupational phenomenon, or it's work-related stress. Some doctors and physicians and also other healthcare providers debate on this, saying that it cannot be only related to work. For example, if someone is taking care of or help caretakers at home, taking care of your loved ones at home is not a job. It's not an occupation. You're not working somewhere. It's the stress in there, and the result of the stress as a result of that burnout happens is not work related. So there are other ways that also it's environmental, it's emotional, it could be as I said, that example at home, or it could be the other stressors like chemicals and everything else can be also causing burnout. However, it is very common, and it's the most I would say the most common one is the one which is work related.
And what have you heard in your circles about the impact of the pandemic on healthcare and burnout?
That's a very question, Pat. Good question, Pat. And it's so in the healthcare industry, as always, the healthcare providers are actually always competing and racing against time, and their job by nature is basically very hectic all the time. And during this pandemic that started in as the December last days of December, that's why it's called COVID-19 in 2019, and then during 2020, basically there was a lot of challenges in the healthcare industry that made the healthcare providers suffering a lot more than anybody else in the front lines, and the CDC actually mentioned about such programs and such issues in the healthcare industry that so you could, I was just looking through some of the statistics that I had. The US healthcare workers actually during COVID-19, the infections and the fatality rates in the, this one was a while ago through CDC, but which is May 2020, 69,761 cases were actually in the healthcare workers and 368 deaths. So if you see this one as an example, the infection rate with all the measures that the healthcare industry is taking with the PPE and healthcare providers being aware of the virus. However, in the very beginning, it was really challenging and new also to the healthcare providers. It had the burden of COVID-19 on the healthcare industry was huge. And unfortunately, a lot of people, including nurses and doctors and all those people who are working at the healthcare industry, they either had to take leaves because of the contracting the COVID-19, or as a result of that, some unfortunately even lost their jobs or they quit their jobs. So it was overall a very challenging time for healthcare industry. And as I said, like earlier, that the healthcare industry is always, a hectic job. You're always running against time. And when such issues like this COVID-19 pandemic happens, it basically even more depletes the resources, and it makes it more challenging for healthcare providers to tackle the issue.
So we have the immediate impact, and I'm sure our listener remembers that time of healthcare facilities scrambling to get PPE, asking staff to reuse it. I talked to a nurse in California who worked in a nursing home where she was required to put a garbage bag over her head, and that was supposed to be her protective clothing. Now we are at this point, we're recording this in the end of May. We are 2 years into this. And I hear and read a lot of headlines about people who are burned out and leaving healthcare. Can you comment about where we are and why that's happening at this point, 2 years later?
That's again a very good question, Pat. I think the first wave of COVID-19 when it happened, it was, as I say, it was new to the healthcare industry as well. And we were all trying to find what exactly this virus is and how can we prevent it, how can we save lives. And during that time, with as you just mentioned about the PPEs and all the other preventative measures that we were trying to take, unfortunately, again, it was really difficult to contain the virus. And so many people, as I mentioned earlier, in the healthcare industry contracted disease. And we are 2 years already, like more than 2 years now into this pandemic, and we're still, struggling and seeing that the consequences of COVID-19 as people contracted is really different in different people who have experienced it, and the fatigue after that, and the other health issues, or some of the healthcare providers who quit their jobs because of the disease, and some of them, as I mentioned earlier, were taking leaves. So, if you study the healthcare industry in the U.S., the number of healthcare providers it was not enough in the first place. As opposed to the population. But during COVID-19, when healthcare providers either quit their job or unfortunately, we lost some of the healthcare providers, So that made it even more challenging for the healthcare industry. And as you mentioned, the question that where we are now, I think it is really difficult at this point to see that the healthcare industry that had that many not enough healthcare providers in their the hospitals or in the healthcare industry in general. Now it's even less for those aforementioned reasons, and it's going to be challenging. However, we are in a better position as far as the vaccination, is available now for people. People know more about the disease and preventative measures, but still, the healthcare industry is actually feeling the lack of enough healthcare providers.
Is burnout reversible?
That's a very good question, Pat. So the burnout is actually, as we mentioned, that why is it happening? I wanted to mention before answering this question that why is burnout happening is that's in the health, especially in the healthcare industry. It happens in across industries. It happens in all other professions. So teachers burnout or healthcare providers burnout, entrepreneurs burnout. The depends on the root causes. I would say that if we look for the root causes of every disease, every I would say health problem, then we should look for the underlying cause. As I mentioned earlier in my why did I switch from clinical to public health, is the that I didn't see the root cause, that I was treating the root cause of those patients. So if we look for the root causes of burnout, why is burnout happening in the first place? As we mentioned, there are so many reasons. If it is the work-related issue, which is the most common one, it is reversible. So if we go back to remove all the underlying causes or root causes that causes burnout in the first place, then people can switch back to a normal life and be less stressful. And unfortunately, I cannot say that 100% it would be, because this is still a debate, and some people may have unfortunately some consequences that is probably taking them longer to recover.
Mm-hmm. When you think about all of the years that you put in to becoming a physician, to become a pediatrician, all the years that nurses put in to get their education, it seems like there's got to be a way to prevent burnout.
Mm-hmm.
The loss of all of that investment of time, of ego, of education. I see experienced nurses leaving the healthcare field, and they take with them so much wisdom, so much that is necessary to teach the younger, less experienced nurses in particular. What are some solutions to prevent burnout?
Before we continue with the show, I'd like to share this special announcement with you. Do you feel like one in many in a crowded field? Are you making the most of one of the most effective ways to get the attention of attorneys? We're talking about LinkedIn. Do you know how to best fill out your headline and summary? Are you taking advantage of the best wording for your profile? Does your profile have keywords that will help attorneys find you? Do you know how to most efficiently locate your ideal clients? The LinkedIn Planner for LNCs takes you step by step through the process of how to get attention on LinkedIn, the largest online business network. From how to best describe yourself to how to post high-quality content. The planner is tailored to your needs as a legal nurse consultant, and you'll get so much more. Get your copy instantly through a digital download at this link, http://lnc.tips/LP. That link again is http://lnc.tips/LP. You'll be able to start right away on polishing your LinkedIn profile. Now let's return to the show.
Pat, thank you for asking this question. It's really, again, an important question. To answer your question, I would say that before even answering your question, I wanted to define the health itself. And by definition, again, health, as the WHO defines it, is not just merely the absence of disease. It's it's the well-being of social, physical, and mental. So if we see that health from that triangle perspective, obviously it's not only the physical well-being, it's the social well-being, it's also the mental well-being. And when we talk about burnout and why is burnout happening in the first place, as we mentioned earlier, the solutions for preventing such occupational phenomenon, I would say that it has to be actually addressed at three different levels. One, I would say at the individual levels. Second, I would say that the institutional levels, and then third, it would be at the population level. By individual level, I mean especially the healthcare providers, from nurses, as you just mentioned, that they're taking a lot of the burden of the healthcare services, and they do a phenomenal job. And every other healthcare provider. Now that we say that burnout is not only in the healthcare industry, I would say, because your audience might be also some other people who are not healthcare providers. In general, at the individual level, people can practice mindfulness, for example. Nowadays, people, doing yoga or meditation or prayer and exercise, these things that can be done at the individual level, that everyone should pay attention to their health. As I said in the definition of health earlier, that it's not only physical. So if you do your physical activities, that is good, exercise is good, but then also you have to be well mentally, you have to be well also socially. You cannot disconnect yourself, especially from family and loved ones and the society. And as I mentioned earlier, that the healthcare industry jobs are very hectic. So we have to make sure at the individual level that we can find time for ourselves. We should practice mindfulness, as I said, exercise, and we should also unwind from this digital world. Sometimes, people get so involved in this world that is difficult to think about unwinding. So that would be at the individual level. And at the institutional levels, this includes the hospitals, businesses, universities, actually to incorporate, first of all, the hospitals and other all healthcare industries should acknowledge that burnout is a common problem. It's very common, and unfortunately, the healthcare industry or even the healthcare providers themselves think of burnout as a stigma, and they don't want to talk about it. It has to be acknowledged and addressed at as an occupational phenomenon. And those programs and projects should be integrated into at the institutional level, so that we can address such issues, find solutions for it, and make sure that the healthcare providers, we first of all have enough healthcare providers, and also incorporate some kind of activities for them that tackle such issues. Also making sure that they have enough time as I said, to have not to think about their own health. Because if at the end of the day, if a healthcare provider's health is compromised, definitely the health of their patients and people who they take care of can be compromised. So that is at the institutional level. I think it's important that it should be acknowledged and addressed. And then at the population level, I wanted to express this or explain this at this level as a short story that is called Expert and Expert. And when I was back in Afghanistan, the reason I said my why is also because I wanted to connect that. And I was sitting at the hospital, in a tertiary hospital during my residency in pediatrics, where we were seeing like 100 to 150 patients a day. And this story of Expert and Expert is also similar to that. There was a young doctor a medical student who wanted to become a doctor and a physician who could help people. So he becomes a physician. He's really good in his work, and then he goes to a remote area somewhere, and then he starts treating patients. As he's treating patients, he takes a good history of he talks, communicates well with them, asks their problems, and comes to a conclusion, makes a good diagnosis, and then give the appropriate treatment for them. So patients are happy. They go back to their communities, to their families. They tell other people. And then the next day, there's more people coming. So this doctor is good. So we let's go see him. And then the next day, the number increases, the number doubles, triples, and this poor doctor has to cut his lunchtime. Then the next day, the number increases again. So it eventually there's a long line of people behind his practice, and everybody's asking that, why are you spending so much time with one patient asking all those questions? And you should decrease that amount of time and see more patients. So he's unfortunately he loses his lunchtime break. He cannot actually spend that amount of time to ask questions or take a good history from his patients. So eventually then he has to say next, and he becomes from an expert to an expert. So the point is that at the population level, when we think about burnout or any other health issues, we have to make sure that the awareness in the public about such issues is we need to raise awareness. In that case of Expert and Expert, if people knew that, in my case, for example, at the hospital where we were seeing pneumonia or bronchiolitis or diarrhea diseases that are preventable at the community level, if people knew about basic health, information about hygiene, about environmental sanitation, about preventing diseases, those could be done at the community level. When we talk about burnout is also similar. If we talk about all the underlying causes or the root causes of burnout, why is it happening? If people's information and people awareness is enough, especially during this COVID time, that a lot of people, unfortunately, who were going to the hospitals, and I'm talking not only about the US, but across the world, especially my country of origin, where in Afghanistan, without even knowing about the signs and symptoms, or if they were suffering from COVID, they were exposing a lot of other people along the way to the disease, and including the healthcare providers, and depleting all the resources. So that is why is it happening? It could be prevented at the community level. If every individual knows about it, has there's enough awareness about anything, especially with this burnout, then we can prevent it at those levels. So again, if I want to summarize it, it has to be at the individual level, at the institutional level, and then also at the population level.
Yeah, you've given us a great model to consider in thinking about burnout. I know that some people join Legal Nurse Consulting and become entrepreneurs because they feel they are getting burned out in a clinical role, or they're at risk for burning out. Mm-hmm. However, you've also pointed out that if we work just as hard in our business all day, all evening, 7 days a week, that we can create for ourselves the same environment of high stress.
Right.
And that by paying attention to our individual stress management techniques, which we have control over in our own business, we can be kind to ourselves, not get caught up in burnout.
Absolutely.
And as I think about the production pressure that you've described, the expert who became the nexpert, some of the cases that we review as expert witnesses or as consultants occur because there is so much pressure on the healthcare system to get that person through the system into that family practice office and out as quickly as possible, into the hospital and discharged as quickly as possible, into the OR and out again. I've talked to emergency department nurse practitioners who've had their own production pressure. You've got to see X number of patients per hour. You've got to do your charting at home, at night, after you finish seeing the patients, when you may not remember the difference between Mr. Jones and Mr. Smith. So the institutional pressure contributes to burnout as well.
Absolutely.
Well, I know that we could talk longer about the subject, but we won't today. We'll end with me asking you, for somebody who's listening to this and wants to know more about how to connect with you, what would be the best way for them to be able to do that?
Thank you, Pat. First of all, thank you for providing me this opportunity to talk about this very critical topic, and thank you for your time. They can reach, as you mentioned earlier, they can find my podcast, which is called With Dr. E. And with any tools that they use to listen to their podcast, it's on Apple Podcasts, on Spotify, on Radio Public, you name it, and it's there. They can also reach out to me through my LinkedIn, which is same name, is Hamid Elmyar, and I would be happy to, if they just shoot me a text or an email, having any questions specifically, that I would be happy to address. I'm also working with a number of healthcare providers to work on this, as a package to provide solutions for burnout, and that for the time being is under progress. So we would work on that when it's ready. I would be happy to share with you and your audience.
That's great. I appreciate that. I appreciate that you are focusing on this, because this is a condition that causes, in my value system, a tragic waste, a tragic loss of education and commitment from healthcare providers that we all are going to need in greater numbers than we have now. And for our audio audience, Dr. Hamid's name is spelled Hamid, his first name, last name ELM, Elm, Yar, YAR, ELMYAR. I appreciate the time you have spent with us. And for you listening to this podcast or watching it on our YouTube channel, please be sure to leave a comment below, give us a thumbs up or a thumbs down. Tell us what was meaningful for you in this podcast, and be sure to come back for the next show. Thanks so much.